orthopedic surgeon at OSC. My specialty is shoulder problems. I wanted to discuss a particular device we have now. It's called a reverse total shoulder arthroplasty. Now, just so we understand, originally you have a ball and a socket in your shoulder, and the problem that happens to many people is that the joint becomes arthritic, the cartilage surface is worn down, so the two bones are rubbing bone on bone. Now that can be treated with a shoulder replacement, same as you replace your hip or your knee. You put in a ball, and you have a socket, and you put in a metal ball, and you put in a plastic socket. They move fine, and they work very well, eliminating pain, improving function, as long as the rotator cuff is strong. Now the problem we have is, we'll have people all the time who have that arthritic process, but also have weakness or damage in their cuff. And we've learned over the years, if you put in a conventional shoulder replacement, they'll get good pain relief, but they will not necessarily get good function in their shoulder, and this can be frustrating. So for my entire career, up till about 10 years ago, there was no good treatment for that combination of an arthritic shoulder combined with a rotator cuff tear. And some very clever French people came up with a device which has evolved and now is the current treatment that we use, which is called a reverse total shoulder arthroplasty. Where there was a ball, we put a socket. Where there was a socket, we put a ball. And by changing the lever arm of the shoulder, the deltoid muscle on the top of the shoulder is then able to lift the arm without having a rotator cuff in play. So we've taken a problem which was unsolvable before, and we've gotten a very good solution for it. It's primarily designed for older people, but we find ourselves using it for younger people at times because it's the only choice available for them, and we see uniformly good results with this device.